At ASCO 2023, I'm very happy to present on behalf of all the co-authors the end-of-study results from CARTITUDE-1 clinical trial. So this was the registration study that FDA reviewed to approve cilta-cel or CARVYKTI that's now available for standard of care patients who's had 4 prior lines of treatment in United States. The CARTITUDE-1 study was conducted for patients who'd had 3 prior lines of therapy and exposure to major backbones of myeloma treatment with a proteasome inhibitor, IMiD, and a CD3 monoclonal antibody. And these are heavily pretreated patients, and we have already seen with the primary analysis that a single dose of cilta-cel induced very deep response, with 98% of the patients having overall response and 83% of the patient having deep response with stringent CR. And up until now, we haven't seen the median progression-free survival being met. So finally, this year, for end-of-study results, with a median follow-up of close to 3 years, we're seeing that the median PFS is 35 months for all patients on study, so almost 3 years. And for patients who achieved stringent CR, that's 38 months, so a little bit longer than 3 years. And for patients who achieved MRD negative status that's sustained for at least 12 months post cilta-cel infusion, that for those patients, the median PFS has not yet been reached. And overall, the median overall survival also has not yet been reached. So continues to show that this CAR-T product has very impressive response in this patient population. And so related to that, I'm also very excited to hear my colleague's presentation on CARTITUDE-4 study, which is the same CAR-T product in earlier line setting in a randomized control study against standard of care triplet regimen. So we're anticipating that this is something that FDA will also look at to consider the use of this CAR-T product in earlier line setting for our patients with multiple myeloma.